it is ludicrous. What Health Canada specifically is trying to do with their attempt to increase regulation of natural health products is they really want to bring them under the same umbrella as the very drugs that you just mentioned, plus novel experimental drugs. Basically, they want to regulate them, have them fall under the same umbrella of regulations that synthetic drugs manufactured by Big Pharma.
Help save our natural health products. Just $2 allows Bright Light News to continue exposing the government's push to an all-synthetic drug model of medicine. Please donate today at brightlightnews.com or send an e-transfer to gord@brightlightnews.com and enjoy this interview with Dr. Bridle. Hello, ladies and gentlemen. We're honored to be here again with Dr. Byram Bridle, viral immunologist and vaccinologist. Thank you so much for joining us, Dr. Bridle.
It's my pleasure, Glenn.
Excellent. So we're here to talk about strange days in Canada now, indeed, where we are seeing the illicit drugs in BC being decriminalized, like cocaine, methamphetamine, MDMA, and opioids, including heroin, fentanyl, and morphine. Yet at the same time, we're seeing a tightening of regulations on natural health products. Is there a need for safe natural health products to actually be regulated more so than they already are? I mean, I've never heard of anybody ODing from vitamin D, from probiotics, none, and at the very least, even a homeopathic remedy, which is dubbed to be just water. What are your thoughts on this, Dr. Bridle?
Yeah, thanks for bringing up this important topic, Glenn. Canadians should be very concerned about these proposed regulations. What they need to understand is this is going to this has the potential to dramatically increase the cost of natural health products for Canadians. It also has the potential to put a lot of people who are working in the natural health product industry out of work. And the last thing that we need for Canadians is less accessibility to products that can optimize their health naturally and relatively cheaply. Right. This is a way people to remember is natural health products. It's a way for people to in many ways, manage their own health. And I'm not talking about treating specific diseases. I'm just talking about making sure that their overall health status, for example, that the functioning of their immune system is optimal. Many Canadians don't understand that their immune systems, because they're not getting enough of some natural health products. For example, Canadians are notorious for having too low a concentration of vitamin D. As a consequence, that is a critical component of the immune system. So most Canadians' immune systems are not functioning optimally. And if you have optimal health among a population, you're going to dramatically minimize the overall disease burden and therefore the burden on the healthcare system. And what I want to point out, Glenn, you made an excellent point. We don't seem to, for the products that are being properly researched, manufactured, and distributed, they are safe. I haven't seen any issues of those being safe. Now, to me, are there some people out there who maybe aren't following the current regulations properly, which could be compromising safety? Yes, like in any industry. And people who aren't following the regulations properly should be targeted, right? And that should be corrected. But we have the existing regulations to do that already. So to do this carte blanche against all natural health products makes no sense to me. And I actually just want your audience needs to understand something, because indeed, the Canadian government is looking at introducing all kinds of regulations, and they're saying, well, again, I always find it better to put it so it's not my words, but other words directly. So I just want to read you a quote. This is from an article that was put out by Global News. And they're quoting Health Canada here. These changes would protect the health of Canadians by enabling regulators to take stronger action when health or safety issues are identified with natural health products on the market. So they're claiming this is about protecting the health of Canadians. But now, get this. So now what I want to do, Glenn, is I want to read one sentence taken directly from Canada's current regulations on natural health products. So Canadians can go to Health Canada's website and do a search. If they do a search on Health Canada, natural health products, and regulations, they'll come to the front page of Canada's website for regulating natural health products. Get this. This is what they have to say. So keep this in mind. They've just told Canadians they need to introduce these regulations to make sure that they have safe natural health products. The regulations, so these are the existing regulations, Glenn, that were put into effect on January 1st, 2004. And I quote, the regulations help give Canadians access to a wide range of natural health products that are safe, effective, and of high quality. So I would rhetorically ask, Glenn, what greater need is there for additional regulations? What more do Canadians want than natural health products that are safe, effective, and of high quality? And I'd like to raise another issue here to highlight some hypocrisy with Health Canada here, because they have to decide what their message is to Canadians. Is this the message which they have posted since 2004? Or are they now trying to tell Canadians that since 2004, they have failed through the regulations to ensure that the natural health products that Canadians using are safe and effective and of high quality? And if they have failed to do that, that means they have been lying to Canadians about the safety and effectiveness and the quality of natural health products since 2004. And if they've been lying to Canadians about the safety and effectiveness of natural health products for that many years, what other products that they have been pushing very hard on Canadians for the past few years that they have been claiming ad nauseum are safe and effective might not be?
That's a great point, and I know exactly what you're talking about. We're seeing overwhelming evidence from around the world that the COVID-19 so-called vaccines are causing tremendous amounts of adverse effects. We're seeing excess deaths rise around the world in a consistent fashion. It doesn't matter which country, which continent, it doesn't matter the timeline, or the season even. It's just a consistent fact that we're starting to see. And, you're highlighting that, natural health products are safe, and Health Canada regulated them as safe, said they were safe. And the latter, you being a scientist and always putting out that other hypothesis, is did they make a mistake? I don't know. I just saw an article from CBC that shows that illicit drugs involved in deaths in British Columbia from 2019 to 2022, multiple drugs could have been found in the person who OD'd. Illicit fentanyl and analogs in 86% of the deaths, cocaine in 45% of the deaths, methamphetamines and amphetamines in 42% of the deaths. I mean, we don't see charts like this. We don't see staggering death numbers like this for natural health products, yet they're being regulated. And at the same time, we're seeing these be decriminalized and now legal to carry in British Columbia for up to 2.5 grams. I mean, it's
that's incredible. They consider 2.5 grams of those illicit drugs to be small quantities. Maybe they're small quantities if somebody is using them over the course of a month. But what's to stop an individual from using them as a single dose and overdosing on these things and potentially getting them into the hands of people who shouldn't, like children? Yeah, you raise a great point. It is ludicrous. Just so people understand what Health Canada specifically is trying to do with their attempt to increase regulation of natural health products is they really want to bring them under the same umbrella as the very drugs that you just mentioned, plus novel experimental drugs. Basically, they want to regulate them, have them fall under the same umbrella of regulations that synthetic drugs manufactured by Big Pharma fall under currently. And as you mentioned, there is a world of difference. You just listed the fact that indeed it's now legal to carry that amount, up to 2.5 grams of those illicit drugs that Health Canada, like our Canadian statistics have already shown kill huge numbers of Canadians, in stark contrast to natural health products. Yeah, like you said, how many people do you know that have died from vitamin C? It's absolutely ludicrous, and Canadians have to understand this. And there's an additional thing that Canadians need to understand. Not only are these two very fundamentally different products, but there's a conflict of interest here, I believe, Glenn. Because what most people don't understand, most people think of Health Canada regulating drugs and other medical products, like vaccines and so on in Canada. And they have the impression, well, this isn't a branch of the federal government. Therefore, they serve, and indeed, they are supposed to serve the needs of Canadians, being a federal agency. But a lot of people have this misconception, therefore, that they're funded by the taxpayers. And that would be a safe mechanism. I believe that should be what the mechanism is, or what mechanism should be, because let's face it, at the end of the day, money drives a lot of decisions. And people don't like facing massive budget cuts. It means people are going to, face job losses, et cetera, et cetera. So it's just natural human nature to follow, or to sort of serve the source of the money. You want to make sure that the customers that you look after the best are the people who are paying your salaries, right? And what people don't understand is Health Canada is only funded in a tiny, tiny percentage by tax dollars. The vast majority of their budget comes from the very big pharma companies whose applications for new experimental drugs they are regulating and that they are reviewing to determine whether or not they are going to approve them. So the vast majority of Health Canada's budget comes from big pharma. So that means where a minority, a tiny minority, comes from taxpayers. So it's just natural again. Where is the greater interest? If they, for example, turn down we're now in the year 2023. Again, I would encourage you to show people on Health Canada's website. They have their fee structure, and I believe in 2023 it's now gone up to about $600,000 that Big Pharma pays for each application that it makes. So if they develop a new drug, synthetic drug that's on patent, and they submit it for approval, along with it comes a paycheck to Health Canada of $600,000. It's being run like a business. And think about that for a moment. If you do not approve that product, and say you don't approve several applications from a company, Canada is a relatively small player in the global scale of things. The Europe and the US represent far bigger business market. So, a company is going to tend to maybe not bring their business there. And what people don't realize is if these things get turned down, or they don't get approval within a 6-month time frame, which puts a time crunch on the review process, these companies get a substantial portion of that feedback. So do you really want to give up a fee that could be paying the annual salary for up to 4 of your regulatory scientists? So there's a conflict of interest here, Glenn, I believe, because what they want to do, get this again, okay, Canadians need to understand what the government wants to do is they want to place natural health products under the umbrella of the regulations that currently exist for synthetic drugs, expensive, on-patent synthetic drugs manufactured by Big Pharma. These policies or these regulations exist to regulate Big Pharma right now, who are the number one payers, the number one contributors to the budget of Health Canada. This is a massive conflict of interest. And what you have to understand is Big Pharma has no interest in natural health products, because what they're interested in, they are businesses. Their boards have the number one purpose is not health. Number one purpose of their boards is to make sure the business is profitable for their investors. And they don't have an interest in natural health products because they can't make a lot of money off of it, because these are natural products that are not patentable in the majority of cases, right? What they're interested in are synthetic patented drugs. So there's a huge conflict of interest with these proposed new regulations, Glenn.
Yeah, and again, when we talk about big pharma style healthcare, I mean, it should really be called sick care, because they're not into prevention like you had mentioned earlier, where as natural health products with vitamins, with supplements, probiotics, all of the products that are geared towards prevention. I mean, this is something that pharma does not want on the market. It takes away their profits. They need sick people. They don't want healthy people. And I just should bring up that all of this is happening under Bill C-47, which was passed back in June. It's received royal assent, I believe, until August 10th. Comments can be made to the government. And under sections 500 to 504, it basically has now classified natural health products, which had their own classification before, to be a part of the pharmaceutical synthetic drugs and devices. So we will see, basically, you will need for any natural healthcare product where you would get the advice of a practitioner, a naturopath, homeopath, traditional Chinese medicine practitioner, where you would need a prescription or the advice. The only licensing scheme that's available from them now for new drug approval is a process by which no natural health product in Canada has ever received approval, and it will never go through going ahead in the future. So this is a very, very scary thing. If you use even, this even goes to cosmetics. Natural healthcare cosmetics will be taken into consideration. There's the new licensing fees. They're going to have to relabel everything. There's costs on that for manufacturing. We're going to see none of the products that have been deemed safe up until this point actually be grandfathered in. They will all have to go through this process again, depending on the classification of their usage and the claims that are made for them. One thing
can I just mention something,
yeah,
Glenn, because you just mentioned something very important, the claims.
With this latest attack on natural health products and push for an all-pharma medical system, it's more important now than ever to expose government and big pharma corruption. Bright Light News is independently funded and funded by the generosity of viewers like you. Please help champion change to save our natural health products. No donation is too small, and all donations are appreciated. Donate today at brightlightnews.com or send an e-transfer to Gord at brightlightnews.com.